Our next speaker is Nick Medrano. He is a research analyst with CNTR who is sponsoring this, and he is a GIS analyst for them. His research specializes in geospatial analyses such as trauma care, accessibility, incident clustering, trauma center location optimization. He is going to speak to us about leveraging this geographic information system, or GIS, to address disparities in access to care. Thank you.
Thank you, Dr. West, for the introduction. So I'll be speaking to you today about leveraging GIS specifically to address disparities in access. Once again, my name is Nick Medrano. I work as a GIS analyst at Center, as well as a lecturer at the University of Texas at San Antonio. So first of all, agenda, we're going to start with just looking at what is GIS. I know some of you have worked with GIS before. This may be a newer subject for others of you, so we're going to start by kind of laying that foundation. From there, I'll be going into center research that we've been doing, specifically looking at access to care. And then from there, we'll look at other trauma research that's being done. What's being done by your colleagues, specifically using this technology to address disparities in trauma. Now, to introduce everyone to GIS and make sure that everyone is awake this morning, we're actually going to start with a little activity, get everybody involved. So I know that we've got a couple of movies that came out this past week. There's a lot of buzz around them. So we've had Barbie and Oppenheimer both come out last week. I'm sure many of you have had the chance to see it. Maybe others of you haven't. You're looking forward to maybe seeing them. I know we're all very busy. But we're going to start with a little activity looking at which of these movies, we don't need that, which one of these movies would you be most excited to see? So let's say conference ends today. We're all going to go to the movies. You got to pick one. Which one are you going to go see? All right, so we've got Barbie and Oppenheimer, which is about the Manhattan Project, right? Very different films, okay? So, and for those of you on Zoom, you can participate as well if you want to put in chat. If you want to go see Barbie, throw a B in there. If you want to go see Oppenheimer, you can throw an O in chat. All right, you guys get to participate, okay? So we'll start with Barbie by a show of hands. You have to pick one. By a show of hands, who wants to see Barbie? Okay, and now Oppenheimer. Wow, that's pretty close to 50-50, I would say. Okay, so what does this have to do with GIS, right? What is this guy talking about? So data has been taken for the week before the movies came out, right? The week before they came out, this is Google Trends data, which just looks at analysis of who's searching key terms related to Barbie or Oppenheimer. So this data, very, very simple data, let's just see who's searching these terms, and then let's break it down in a geographic way. Let's look at these different states. Which states are more interested in watching these films? So you can find your state up there, kind of see where you were based off of who's in your state. But we can see a couple of trends here already. So first of all, pink being those states that are interested in Barbie, and then blue being those states that were interested in Oppenheimer. A couple of kind of highlights here. New Mexico, right? Very dark blue, really interested in Oppenheimer. Makes sense. That's where the film takes place, right? Los Alamos. So it would make sense that New Mexicans are very interested in going to see that. But I don't know what's going on with Mississippi. Why is Mississippi so excited to go see Barbie? So, you know, we're all researchers here. We know that when we complete analyses, a lot of times we end up having a lot more questions than we originally thought, you know, we would have when we get our results. So we could definitely delve deeper into this. I don't know what's going on in the South, but the South apparently is really excited to see Barbie. So that is a very simple example of how we can use GIS. We can take very simple data, we can create a map, analyze it, look at our spatial distributions, and then potentially have many more questions based off of that. So a little bit more of a textbook. What is GIS? GIS stands for Geographic Information Systems, and it just combines some form of geospatial data uses some form of analytics. I'll talk about different types of analyses that you can complete. And then eventually we're going to try and visualize this data in some way, and then understand patterns, relationships, and trends in the data. Looking at it kind of more as a whole, GIS is going to take the software, hardware, which could be the computer you're using, as well as things like GPS units in EMS. We're going to take that data, complete some type of analysis with it. I'll share a couple different types. And then, of course, there's the people, right? There's myself, the analyst, completing the analysis, but then, of course, there's you all who are going to have all the very interesting research questions, right? So that is what GIS is. I'm going to talk now about kind of what we've been doing at Center. So at Center, we just published this last month, Access to Trauma Center Care, a statewide system-based approach. So what we did was we analyzed access to trauma care for 5 different states. These states were mainly a part of the MIMIC project, if you're familiar with that project, looking at pre-hospital mortality. And what we did was we estimated population access to trauma care within that golden hour, that first 60 minutes. After completing that, we then identified optimal locations for if we were going to upgrade an existing level 3 or level 4 to a 1 or a 2. We identified which center where that would make most sense to provide the greatest increase in access. So we see this as a starting point. Of course, we can add more depth to looking at where we're going to be expecting populations to grow and further that analysis. This is kind of our first base, setting up this system-based approach. So 2 major steps in completing this. The first one was compiling the data to create the network. So this is getting location data for things like where are ground EMS stations, air EMS, of course, trauma center locations, their designations. And then we're going to overlay that with road network data. So think you take out your GPS unit and it gives you an estimate of how long it takes to get somewhere. We're going to overlay that on there. And we're also going to overlay census data as well that's going to provide us population data. So that's kind of how we built the network. And then from there, most access papers have taken a more simplistic look at defining access, and that's just a 60-minute drive in any direction from the trauma center. So they typically have just one interval. We broke up our access into 4 different intervals. So we're going to look at activation. So that's going to be from the time that someone picks up the phone, calls 911, we're going to have some time between when that happens and the EMS unit is actually headed towards the scene. So we accounted for that time using NEMSIS data set. Response time, that's just going to be how long it takes the EMS to get to that particular location. In this case, we were analyzing census block groups. On-scene time, right? How long does it take to stabilize the patient? Once again, we use the NEMSIS data set to give us a metric for that, and that is also based off of rurality. We understand that urban environments are going to have slightly shorter on-scene times than rural. And then finally, the transport the patient actually from the scene to the trauma center. So we completed this analysis for these 5 states. This is kind of what that network would look like when we build it out. So New Mexico was one of our states. So trauma centers, their levels, ground EMS, air EMS. We build this network, and then we're able to run the analysis. And then we get some maps that look kind of like this. So here's the results for the 5 states. I have 3 maps on top. We have Washington starting on the left, Maryland, and then New Mexico. So the gray areas represent access within 60 minutes, within that golden hour. The dark, almost black areas are for after we've identified where the most ideal location to upgrade a trauma center would be. We then have that now increase in access. And then all the white areas would be where what we would call a trauma desert. There is no access within 60 minutes. In this case, we're looking at specifically level 1s and 2s. We did the analysis as well, looking at 1 through 4s. So our major results for these 5 states, when we look at them as a whole, 87% of the population had access to a level 1 or 2. If we did go through the process of adding just once level 1 or level 2 to each state, we saw that increase to about 92%, which represents a little bit over 1 million people. So a great place to kind of start. What we did notice, a lot of variation depending on which state we were, analyzing. New Mexico had the lowest access with around only 60% of their population having access within an hour. So other research that's being done in this field, specifically related to trauma, Dr. Berry you mentioned the study yesterday, so race and ethnicity and geographic access, specifically in urban trauma care. So we had Tung and colleagues look specifically at the three largest cities in the United States, Chicago, Los Angeles, and New York City. The colors on these maps here represent, orange represents low access, blue represents high access, and they came to the conclusion there were Black majority census tracts were the only racial or ethnic group that appeared to be associated with disparities in geographic access. And that was, they found that to be true in Chicago as well as Los Angeles. Another paper here specifically looking at youth violence prevention. This was done in San Diego by Doucette and colleagues. Starting on the map on the left, I do apologize, it's a little bit small. The yellow dots there represent incidences of youth violence, assaults. So that's what those yellow dots represent, and then the kind of background symbology of those browns and greens represent the different racial majorities for those particular areas. On the right-hand side, they then completed a cluster analysis to identify statistically significant clustering of those incidences, and then how they've color coordinated those. And then their conclusions, geographic information systems analysis of specifically registry data can identify high-risk areas for youth violence and correlated social and structural determinants. And then they specifically found that unemployment and poverty were the significant predictors of where these clusters would occur. One more paper, Vogel and colleagues were looking at ambulance contacts in Denver. So what they did, these first maps, they did something a little bit different where they looked at the temporal element of rates of calls during the day versus at night. So the left-hand map is EMS calls during the day. The right map is at night. And this map just shows the rates themselves. So very simply, the darker the red, the higher the number of calls in a given year. And then what they did with this data is they ran a more sophisticated analysis to identify statistically significant clustering in these census tracts. So we have the data on the raw data on the counts, but now we need to compare all the different tracts to one another and identify these clusters. So they then also stratified, blue being medical and trauma overlap, light blue being medical specifically, and then green being trauma. Once again, we can see a difference between where these services are needed during the day versus where they're needed at night. So disparities existed in the distribution of medical and trauma EMS calls in various census tracts they found, and identifying neighborhoods in which there's an incidence of higher medical and trauma emergencies is important to guide EMS care delivery and may help facilities target public health interventions. Right? We have to understand where it's happening. So those are some of the research that's being done. I did want to share something a little bit different. This metric called Area Deprivation Index. This is being done out at University of Wisconsin School of Medicine and Public Health. This measure is based off of a measure created by HRSA. It looks at geographic area-based measurements of socioeconomic deprivation. It does look at census block groups. That's kind of how they defined their neighborhoods. And pretty much what this ADI does is combine 7 different markers of census data and creates one score for each tract. And then I'll show you on the next slide, it kind of compares them. You can compare them in different ways. So I just brought up the one for Illinois, right? We're here in Chicago. This data, starting with blue to red, blue's the least disadvantaged block groups, red being the most disadvantaged. As I said, this is one score, taking all those metrics together. But something interesting that they do is you can break down this data in multiple ways. You can look at your state-only deciles. So if you are interested in looking specifically at your state and which areas in your state are most and least disadvantaged, you can do that. But then you can also look at national percentiles to see how you're doing compared to the nation as a whole. So this is a great example of data that we could combine with the work we've been doing at Center, looking at access and comparing and overlaying these data together to look at the impact that, in terms of access, advantaged versus disadvantaged groups and what type of access do they have. So in summary, GIS enables researchers to do a lot of different things, analyze spatial patterns of trauma incidences. That's kind of one of the bread and butter of looking at cluster analysis and identifying very specific areas where certain types of trauma are existing. Analyze transportation networks and looking at access as a whole. That's mainly the work we've been doing at Center. Optimizing healthcare resource allocation, whether it's understanding where we need to start building our new trauma centers or where we need to start allocating EMS resources. Looking at health disparities assessments such as the ADI, Area Deprivation Index, we can build those types of measurements. And then finally, understanding how diverse communities experience these types of trauma differently, right? Take that all together, right? It really comes down to now we have this information that will make it easier for us to enable policymakers to address these disparities if we're able to clearly display to them that these disparities exist. So I want to leave you with a quote from Jack Dangermond, who's the founder of Esri. So he's kind of one of the pioneers of development of GIS technology. And he says, the application of GIS is limited only by the imagination of those who use it. So thank you for the opportunity to speak with you on this topic today, and I look forward to any questions you have during the panel discussion.